Okay, I think we'll zip around the Zoom room here and just let us know who you are. I think everybody knows everybody, but if you've got an update that you'd like to share from your corner of the landscape, we'd love to hear it. And I think I'll start with Commissioner Brotherton.
Hello, Greg Brotherton, Jefferson County Commissioner. I don't have an update prepared.
Good enough. Patrick?
Patrick Johnson with NAMI, Jefferson County. Good afternoon, everyone.
Thank you. Patrick also gave us a link to an article in the Peninsula Daily News talking about the new center in Sequim. Have a look at that. Barb.
Good afternoon, Barb Jones. I am the CHIP program manager at Jefferson Public Health. I'm still new, so I don't have any updates.
Good to have you here. Brett.
Brett here. We're in the, I guess, post-ictal state of the merger with Port Ludlow. I guess that's a good metaphor, and still finding round pegs to pound in square holes as the two agencies kind of administratively come together. We've been operating together for well over a year, but yeah, still learning little things that are behind the curtain that we need to align. But other than that, yeah, everything's kind of happening a million miles an hour.
Well, it's good that you're here. Thank you. Jim.
Jim Novelli at Discovery Behavioral Healthcare, and I'm still recovering from 2 days in Olympia dealing with legislatures.
Anything exciting happen there?
You know, they act like they hear what you're saying, but I think there'll be more money in behavioral health again this year, maybe more than we're hoping for, but they seem very open to increasing the Medicaid rate again, maybe doubling it this time. So it would be exciting if they did that. So
That would be. Thanks, Jim. Anya?
Hello, I'm Anya Callahan. I'm a contractor and a social worker working on overdose prevention and education. Today, I'm zooming in from Olympia at a coffee shop. I'm down here at Recovery Advocacy Day with Washington Recovery Alliance. Had the opportunity to speak to representatives and my senator this morning and share some of our legislative priorities and ask for their support. So that was great. Another update is that I'm organizing 2 film screenings. There's a page about that in the packet today, Love in the Time of Fentanyl. It's a new PBS documentary about an overdose prevention site in BC. So there'll be a screening in Quilcene on Thursday, I believe that's the 23rd, and a screening in Port Townsend at the Nest on that Saturday, the 25th. So I hope to see some of you there. I also wanted to share that I recently accepted the position of the harm reduction coordinator with Jefferson County Public Health. So I'm really excited to be able to continue the work with the BHC and now be in a permanent position with the county. The budget for my wages is now going to be appropriated into programs. So we'll have some funding to support, no, not appropriated. So the budget that I came up with for what you guys approved last month, a majority of that was programs. So I'm expanding the video project there, and I'm still going to be using this generous funding to support harm reduction projects here. So thank you very much. I think that's all I have today.
Thank you, Anya. We can have a whole meeting on Anya. Okay, Cherish.
Hi, everyone. Cherish Cronmiller with Olympic Community Action Programs, your community action agency for Jefferson and Clallam counties, moving along on our Seventh Haven project. I know there's been some good connections with a lot of our partners about, placements at that location. Sadly, we've gotten over 150 applications for that site, of people who likely would qualify or right on the income, line. But between, what our partners are studying there and then what's left, it's feels like not a lot all of a sudden, it's like 43 units and feels like a drop in the proverbial bucket. So, just doing what we can there. So, yeah, I think that's what's relevant for all the folks here, but always happy to answer any other questions.
Okay, not that this is entirely relevant, but I found it interesting. Is it true that the new housing that's been built has an ability to take care of all of their energy based on the way that they did their own solar?
Yeah, so should be a zero energy consumption building because of the insane number of solar panels that you see, but also because of the way that some of the recirculation of air in the building works, water systems, the way the windows cut the heat off if the windows open up, all of that. I mean, the building, was specially rated for this ultra high energy efficiency, low flow toilets, everything. So it's a great testament to trying to lower those operations costs based on the building sustaining itself, right?
Right.
So we're going to see how it does, and but it should, if all the forecasts, everything else are right, and some years might be better than others, right? But we'll see how it goes. So yes, you are correct there.
Yeah, so it sounds like it would reduce then utility costs for people who are living in the building. That's another.
Well, yeah, I mean, that should be, low or next to zero is our hope, yeah.
Okay, all right, well, that's very exciting.
Yeah.
Sheriff Knoll.
Good afternoon, everyone. Joe Knoll, Sheriff. No things to report other than normalcy, I guess you'd want to say. And want to
That is worth
congratulate,
noting.
congratulate Anya on her new job, and surprised that she crossed over to the dark side of county government. But glad to have you be one of us.
In a way, when you
Infiltrate
think,
and change.
when you think about it, that story, Anya's arc is sort of a testament to good communication throughout our community. Chief McKern.
Hey, Tim McKern, Quill City Fire Rescue. Only thing we have exciting to do, we had another save. Thank you to Narcan. And so we're always excited on the south end, and we've been fairly busy. And Jim, my heart goes out to you. I'm actually prepping for our Ledge Day, which is next Friday. And we've got a lot of timber stuff that we're dealing with and a lot of things like that. So that's been my life for probably the last week or so, getting ready for meeting with the legislature. So hopefully you warm them up nicely so they're nice to us when we come next week.
I warned him about certain people, so.
Yeah, thanks, Jim. Appreciate that too. There went your lunch.
I think he probably warmed them up in the bad way.
It's really good to hear about that save too, Chief McKern. Very good news. Denise.
Hi, Denise Banker, Community Health Division Director at Jefferson County Public Health, and super excited to welcome Anya aboard. Lori and Anya and I worked out, a deal, for lack of a better word, that will allow Anya to continue all of the work that she does for the BHC in terms of supplies, et cetera, funding through the BHC, and then her wages will be taken care of by a grant through the health department. So all that money can be used for prevention services instead of wages now, which I think is a win. And then I'm super excited because we had a lot of tobacco and cannabis funding that we were able to leverage into mini grants that we offered to 11 different, we offered an RFP for those, and we had 11 different organizations in Jefferson County, including a little bit in Clallam County, apply for those grants. And we have just completed all of the heavy lifting that was involved in getting that going. And I've got all those contracts and consent agendas all ready to go to the courthouse. So super happy to get 9 people funded at about $46,000 to do prevention work, mostly protective factors work with youth in the community. So that's super exciting to me. Yeah. But
I think just celebrating how many contracts you got ready to submit. Huge. Well done. Matt.
Hi, Matt Reddy, one of the Jefferson Public Hospital Commissioners, and I don't have anything specific to report, but glad to be here. Good to see everyone.
Good to have you here. Dr. Caldwell.
Hello, team. David Carlbaum, EMS Medical Director for East Jefferson County. Thanks for having me.
Good to have you here. Jolene.
Good afternoon, Jolene Cron, Deputy Administrative Clinical Director with Salish Behavioral Health Administrative Services Organization. We have our final staff starting next Monday for our SYNC team, the Salish Youth Network Collaborative. We are sending out invitations and emails to anyone that we have. So I would ask here if any of you are doing youth work or can connect us to additional folks in your community doing youth work. The program is intended to provide care coordination support to families with behavioral health, complex behavioral health needs, with a priority to be working with families who have youth boarded in emergency departments. And we are doing a kickoff Zoom meeting on March 2nd. Those invites had been going out this week. So again, please, I'll put my email in the chat and you can shoot me an email if you would like to make sure that your organization is included or nominate another organization to be connected. We would happily have as many folks as we can join us so that we can work on getting this program kicked off.
I've heard that if you have food, more people show up. I know that's on a Zoom.
This one is Zoom, the first one, and then we will be doing it in person as the second part of the kickoff.
All right. All right. Good to hear. Brian.
Hi, everyone. Nice to see you all. The changes here at Recovery Cafe, starting next month in March, we're going to slightly adjust our hours. Typically what we've done is Tuesday, Wednesday, Thursday, we did lunch service, Friday, we did brunch, but we're going to make it even throughout the week. That was causing confusion for forever. So we'll just do lunch across the board and we'll add an hour each day. So it'll be 11 to 4, Tuesday to Friday. And we hope that additional hours and consistency will make it easier for everybody. So, and I wanted to give a shout out to OICAP and their Seventh Haven project. We've had a young man engaged with the program for a long time who's got developmental disabilities. His family has had the hardest time finding housing for him, and he'll be moving in there at Seventh Haven, and they are absolutely thrilled. They just met with them this afternoon. So thank you for what you're doing.
Oh, that is a win. Thank you, Brian. You guys will notice a little bit later, there's a funding request. We're looking at expanding the hours for the kitchen staff there at the Recovery Cafe, because I don't know if you've been there at one of their lunches, but if you haven't, you should go. Not only is it good food, there are a lot of people there, and I'm impressed with how much they're carrying off with the staff that we funded them at today. Jake.
Hey everyone, Jake Davidson, Jefferson Healthcare. Glad to be here.
Good to be here. Thanks for being here. Let's see, Lindsay.
Hi, everyone. I'm Lindsay, and I'm with the Jefferson County Public Health Community Prevention and Wellness Initiative. Apologies for my weird location. I'm in my kitchen nook. I just got back from Blue Heron because we're figuring out how to fund some youth and family engagement programs there, which is part of an extension of Denise and Laura Tucker's brilliance in finding ways to make those cannabis and tobacco grant applications all happen. So we're really excited about being able to do that this spring. And I guess other update is we're hosting a parenting workshop at the Recovery Cafe. And the workshop is called Guiding Good Choices. And it's something we've done actually for the last 5 years at different intervals. It's a 5-session workshop, which is, and it's a really valuable workshop. I enjoy it personally, learned a lot. And I think that might be all I have to update you on at this time, but great to see you all. Hello.
Well, it's good to have you, and a lot is going on in your corner of the world. Gabby.
Hi, Gabby with Believe in Recovery and Gateway to Freedom. What's going on in our world? Everything. So having There's too much. Just getting some new programs up and going, adding some things to our agency, which is exciting. And overall, I think in the coming months, just be aware things are changing. So it's exciting.
Okay, thanks, Gabby. Lisa.
Good afternoon, everybody. Lisa Ray Thomas, and I'm currently with the UW Addictions, Drug and Alcohol Institute, also with the American Indian Health Commission of Washington State. And as of Monday, I'll be switching most of my time in FTE to work with the team at Mike McDonald and his team at WSU, Washington State University, which I'm super excited about. And I'm going to stay with the UW to continue planning and implementing the 2023 Transforming Our Communities, which is an annual gathering focused on better partnering with and serving people who use drugs. So more to come on that. This year, we're going to do a hybrid of all the content will be virtual because we learned that a lot of more people can participate, but we're going to partner with different organizations around the state to have like regional hubs. And I think the Salish BHASO is one of the organizations that is interested. So stay tuned. And this little guy is my grandson, who'll be 7 months old next week.
7 months. Wow.
Way cuter than me.
Well, no comment on that. I'm going to take us over to look at the agenda that we've got going for today. I just love to get screens set up here so that I can see everybody. So you see today we're going to do a quick look at the funding overview as it stands now. After the votes that we've had of the last couple of weeks or from the last meeting, then we're going to review the feedback themes from data that you all gave us in a Padlet back in November. Then we're going to do a little bit of thinking about what systems thinking is and how that applies to us here. We'll do a little bit of a working session on exploring from each of our perspectives, what is it that some of these other partners around this table in this room are bringing to the table, which hopefully, because we've been talking to each other for as long as we have, there'll be some interesting feedback on that. We're going to take a quick poll about whether or not to go forward with the BHC after the funding ends with this grant in August. And then we've got some additional meeting packet content around the funding request for the Recovery Cafe, some upcoming events that Anya alluded to, got a little bit of an overview of the opioid funding flow from the Attorney General's Hospital, and we've got both Greg Brotherton and Jolene Cron here if there are questions around that. I put in there a list of legislative things that we're following right now, and it might not be exhaustive, so if you have more, feel free to send them to me. Patrick sent me some last week. Anya sent me some. I got some from the Salish Behavioral Health Executive Board meeting. So I'm trying to collect them all in one place so that we are able to, in one place, go see updates on things that we're tracking. And I think that's it. So are there any questions about that agenda or things that you would like to make sure get talked about here at this meeting before I move forward? Looking around. Okay, we're going to jump in then. I always put this slide in just to remind us all, or for anybody who's new here. You know, I did see somebody who was here from DCD, I thought, but maybe that person jumped off, which was a new person. Maybe it was just a wayward link. I put this in here so that if we've got anybody new, they know what this table is about and what we're focused on. I'm pretty sure all of you guys know what that is, so I'm not going to belabor it. Currently, you'll see the list of funding as it stands right now, both the funding for the expanding Anya's communication, education, and engagement was approved last month, as well as the CARES program funding for 2 months of that program in July and August. And I just wanted to give you folks a sense of all of these different things that are funded right now. They all, of course, touch on this behavioral health system. So keeping in mind, they're not random pieces of funding. They all are part of a system that we're trying to create together. Any questions about the funding? Okay, moving on then. I'd like to talk a little bit about the feedback that we got back in November when we asked everybody to give us sort of their perspective on how things are going. And if I were to look at some themes that I took away as I looked at the whole realm of what was given, the top themes were cross-sector collaboration. These are things that you guys appreciate. Cross-sector collaboration, the fact that we can network and problem solve together to address this sort of shared community challenge that we're working on to improve recovery rates in substance use and mental health realms. The fact that we have created a shared language and respect with and for each other over time. The idea that we have continued expansion and understanding of the roles and capabilities of various programs that were perhaps harder to understand or even know about when we were in our siloed perspectives. We've been able to increase engagement with our community around harm reduction and recovery, and folks felt that it was useful to have this leadership and facilitation that happens at this table toward that improved mental health and substance use recovery rates here in Jefferson County. And then on the place that or the opportunities that we have, there was some feedback that some folks would like to clarify what they're offering here. It seemed that there's an opportunity to focus on prevention possibilities, to increase care coordination and creating sustainable systems for handoffs between our agencies. There's an opportunity to supplement the 911 resources more effectively and to provide better support for our remote communities like those down in the South County area. There was a desire for more updates between our monthly meetings. There was a desire to address where competition distracts us from productive partnership toward those results that we're trying to get from this table. And then I think some folks saw the opportunity to make sure that we follow through on all of these improvements and programs that we've put in place so that we don't go backwards as we move into the fall and winter of this year. And then, of course, that leads into the need to assess the commitment level to continue trying to fund this table and the programs that it supports and the collective data gathering and all of our efforts toward this seamless behavioral health system that supports this improvement that we're looking for in our behavioral health recovery rates. So once we've done that assessment, they saw an opportunity to clarify a sustainability plan, which is very much at the top of what we're going to be trying to do here over these next couple of meetings. And then Apple, I see that you just joined us. I want to give you a chance to take a breath. And then if there's anything that you wanted to say to the group, I wanted to give you that opportunity.
Thank you, Lori. I do apologize. Had to come in halfway through. So
No
sorry.
worries.
Just nice to see everybody, and I'm just catching up in the slides here. I did get your packet, so thank you. I'll be in observation mode.
Okay. And I did put an updated link in the chat, which I'm realizing maybe I should do again. Could somebody put that updated link in the chat? Because I can't even see my chat at the moment. So that Apple has it. Thank you. So as we look at all of that feedback, I wanted to take a look at where we have been, where we started, and where we are now. And I think it's very interesting that at the beginning of our tenure, we weren't even called the Behavioral Health Consortium, but we started with a small grant of $100,000 and 4 people who actually are no longer here. We had the hospital was represented by Jen Wharton. Jefferson County Public Health was represented by Vicki Kirkpatrick. East Jefferson Fire and Rescue by Chief Walkowski, and the Port Townsend Police Department by Chief Mike Evans. So in the space of the time that we've had together, while all of that leadership has left and new leadership has come into each of those chairs, we've grown tremendously in terms of who and how many are at this table. And I think that it's a great thing that even through those leadership transitions, we were able to keep focus on what it was we were trying to do and evolve as COVID came. We've been through a lot together as a group, and that we're still hanging together and meeting monthly, I think is worth noting and celebrating. As we look at the top two things, and I'm going to go back here quickly. The top thing that the members said that they appreciated was this cross-sector collaboration, networking, and problem solving. And the top item was that clarification around what am I offering here? So I thought that, you know, sometimes we say the word collaboration and it sounds a little bit soft or amorphous. And I kind of like the idea of using the concept of systems thinking as we're thinking about what we do here at this table. The idea that we are all sitting in silos and we all have our own systems that we're a part of, and a great deal is happening and changing and evolving in each one of those siloed systems. The idea of bringing it all together to address this one thing in the middle, this community use, substance use and mental health recovery, that's what a systems approach is. That's all of us taking all of our systems, but becoming elements of a bigger collective table where we're trying to bring all of our systems to bear on one thing that we'd like to see a result around. So there's a collaboration mindset, but maybe a systems mindset is an interesting way to look at the idea that a systems mindset is a recognition that there is a trend over time that's a result of the system. So whatever system we've got, it is perfectly designed for the results that we're getting. And so if we're all coming to this table and doing systems thinking, we're bringing our skill to bear on discerning what the system is that we have that's giving us the results that we got and tinkering with it so that we change it to get the results that we do want. And one of the reasons why you need all of these different people from these different silos is because there are some barriers to systems thinking that if it's only one or two people at the table or one or two agencies, we have limits to our cognitive capacity, limits to the information that we have access to. We have cognitive bias around selective memory and confirmation bias and short-term thinking and maybe overgeneralization. And so when we look at our approach to this system, we want all of those players to help gird us against the barriers that are there and bring as much as we can to the systems thinking expertise that we have at the table. So all of that is a precursor for an exercise that I would like us to do together now. Because we know that no one knows everything and everyone knows something, I'd like to learn from you what you perceive the other people in this room are bringing to the table. So at the moment, I'm not asking you to tell me what you bring to the table. You've all sat together at this table for a while now. I'd like to know, what do you perceive some of these other players are bringing to the table? Now, that might sound a little vague and big, so I encourage you to think about what specific perspective are others bringing. What patterns could their data added to the data of other players bring to us that would help us collectively identify insights that we need over time? And how can these other players help us understand our landscape from a population, an overall perspective, rather than an individual or a person perspective? So I have a link to a Padlet, which I'm just going to bring over here. And I'm inviting you to give feedback. Now, I know that not everybody gets excited about figuring out the Padlet. So first, let me put the link in the chat really quick. And then also say that if the Padlet worries you, go ahead and put it in the chat. If you don't want people in the chat to know what you've written, send it directly to me, direct message me through the chat, and I'll put it in the Padlet so that we get all of the information in one place. So I put the Padlet link in the chat so that you can see it, and that's what I have showing on your screen now. Now I want to caution that if you try to click on this Padlet that we're looking at together, it's not going to be live. You need to click on the link, go to the Padlet on your computer, and that's where you'll be able to add information. So I thought we'd take a quick look at just a few examples of how I've done this. So what you have in this Padlet is across the top, I have all of the voting entities that are on the Behavioral Health Consortium. So you can see it goes over waves. Don't be overwhelmed. It's just all of us that are all working toward addressing these recovery rates in our community. What I would like you to do is look at these different players, and I'm not saying all of them, but go into some that are not you and tell me what you think these people or this agency or organization brings to the table. What perspectives do they have that we need? What patterns could they help us collectively identify over time? How could their data help us understand something from a collective landscape population rather than from a person perspective? And what barriers might they help us overcome? Now, are there any questions before I let you loose to do this?
Laura, I guess my one quick question to triage our time. How much time are you going to give us?
I thought we'd start with 5 minutes, because if you all are sitting there looking at me blankly in 5 minutes, then I wanted to come back and have a discussion. But let's start with 5 minutes, and if we need more time, we've got more time. So I'll start the clock going. Let me know if you have questions. I've got the chat so I can see it now. And maybe I'll stop sharing this so it doesn't confuse your screen. Just popping in to say, be sure to go all the way over to the end, because I've just added the SBH ASO. Because even though they're not a voting member, I think they're an important aspect of what congeals us and coheres us together at this table.
Hey, Lori,
Yeah.
I think one assumption that maybe I'm the only one making is, or observation is, a lot of us don't know what these acronyms mean. So that might be really constructive to, when we're doing an exercise like this, to try to stretch out the full names of the agency or the organization.
Okay, is there any one that I can illuminate right now?
For me, I'm not sure what JHC means. I'm not sure what L360 is.
So JHC, you're right, they might have even limited down their abbreviation. That's for Jefferson Healthcare, and I'll change that. And OWL 360 is who we've recently given funding to for the Pfeiffer House and for the Nest. So they're sort of our youth representative in terms of services that are going to the youth. Thank you for that.
Yeah, and then the last two, I have no real clear understanding of what those acronyms mean. Thank you.
Okay, thank you. So the Salish Behavioral Health Administrative Services Organization, they're the funding agency for funds that come through the state, but for this region here, and they serve Jefferson County. And ADAI is Lisa Ray Thomas represents them. They're the, let me think, I think it's
Addictions, Drug and Alcohol Institute.
Thank you. I knew I was going to screw up what the 2 A's stood for. And they give us a lot of sort of state access or access to things above and beyond, thinking about funding, thinking about new ideas, a lot of harm reduction research that goes on, and gatherings that happen both including but outside our state.
Yeah, I mean, just for example, I'm counting in my head 4 different acronyms for Jefferson Healthcare that I've heard in the past 24 hours. So I think, and I'm aware what they all mean, but maybe not everybody on the meeting is. So.
Got it.
Acronym-itis is what I call it.
What we've got, okay. And it's a good note too that I should update our acronym slide, which not that any of you all would be looking at it right now.
I've found that very helpful, Lori. I appreciate that. You've always done that. It is sometimes at the very end of the slides, but it's useful. And I'll make an ode to or a nod to the fact that some acronyms are almost identical in nature. We are Jefferson County Public Health, but we can often get confused with Jefferson Healthcare just because our letters are similar.
Just because of the letters. All right.
And the absolute worst government agency at using acronyms is the fire service. I'll admit that voluntarily.
Okay.
Lori, do we have anyone on the BHC that is a person with lived experience?
I know that we have certainly Gabby and who Gabby brings to the table. We have that. We used to have somebody named Scarlett who was here, and Denise. So we have a few that are. We can always
an organizational faction. I just think I think it would behoove us to actually.
Absolutely.
It's really valuable to have someone that represents those folks with lived experience.
Absolutely. I was at drug court this morning, and there was one person there who was just talking so animatedly about her experience at Recovery Cafe. I thought, well, she's somebody who would be great to have at this table. So I was going to go out and recruit her maybe over the next week.
I also think there are others with lived experience that may or may not choose to reveal that, but that's woven into the fabric of their being and maybe informs their decisions.
That's what I was going to say. There's probably.
Oh, sorry, Sheriff.
No, some of us on here that won't admit it.
Couple more minutes. Sort of polling room.
I.e., there's some of us that just aren't nearly as brave as Denise.
Yes, Denise deserves an award.
Lori, in the chat, there's a request to add Jefferson County Public Health to the Padlet.
I do apologize that that's not there. And after all that talk about acronyms. There we go. Yeah, everybody a chance in case you want to add in some things that you think public health brings, since I was so late getting them on the Padlet. Okay, so now that everybody has put in what they think about everybody else, I would like you all to look at the agency that you are from and write as the very last comment under that, what you think that they bring, what you think you bring in terms of perspective, terms that you could help us identify over time. Data that you might have or that you know that you have and have brought, and any barriers you think you could help us overcome at this table as we try to increase recovery rates here in Jefferson County. And Matt, I'm depending on you to look over them all and make sure somebody's doing something under each one. He's on it.
Maybe the otter could do that.
The otter can do everything. Okay, I'll give 2 more minutes.
Sorry, I missed the otter reference. That must be because of my tardiness. I was talking about a coyote before I came to this.
Oh. Well, Otter is this nifty app. Go ahead.
Yeah, you can kick the otter out. I don't have control. I don't know why it joins.
Well, so Otter is what can transcribe meetings, and somehow Matt's Otter app just is excited to join this meeting, probably because our conversation is so scintillating. I have no doubt.
Oh, I think I stopped it. Oh,
It does appear that one day Matt will not show up and the otter will just show up and have subsumed Matt, perhaps. We're not sure when that will happen.
yeah, I didn't realize it would join meetings without me.
Okay, are we close to being ready to end with that? Everybody feel good? Looking for a thumbs up? Everybody had a chance to put in what they know they bring? All right. So now to lay the groundwork for whatever it is we're going to do the next meeting, I'm throwing up this poll. It's a, what do they call it? It's anonymous. And I would like you all to just answer yes or no. Should the BHC continue after the current funding ends in August of 2023?
I guess, Lori, I'm not exactly sure what you mean by the BHC in terms of how it exists this exact moment with you as the chair, or how it would exist were it to become part of the community health improvement plan, forward moving project. So I guess I'm not sure.
I think if you have any idea of what it will be, that's what we'll be discussing, the how and the why and the where at our next meeting. But I think the first question is, do people want to participate in any version of the Behavioral Health Consortium?
Okay, thank you for that clarification.
And Chief Black, I saw you had your hand up.
Yeah, I kind of had a similar response to the question, which seems hard to answer because it's a, you know, it's a radio button, and I'm still even today learning about new things that go on in the county that are outside of BHC, and so I kind of still struggle to kind of see how they all fit together. I've had some conversations with a few people offline on this group as well, that I'd like to see a more strategic integration and organization rather than like little, I think you used the word silos earlier. I don't, it's not, that, to me, silos kind of sounds a little, I'm not saying you meant it this way, but I kind of feel that that's kind of almost a negative statement, because I think silos sometimes can be useful and natural, but at the same time, I'm still trying to figure out how BHC overlaps or integrates with other efforts that are outside of BHC. So yeah, I don't know that I'm comfortable even answering it yes or no, because I just don't, there's too many question marks in my head.
Okay. Maybe we should be asking then, is it worth continuing this conversation at the next meeting, or do we need to set it down and wait until after the grant is ended for people to decide what it is that they want next? And maybe we don't try to decide that in this, we just finish out the term of the grant. I'm happy to do what the group wants.
Would there be a data reporting requirement moving forward after the grant?
I think that would depend on what sort of funding you had. I mean, we've done a great deal of work at collective data gathering efforts. And there's a piece of me that thinks if you set it down now, that will all be work that we did setting groundwork that we'll just give up. But that might be what the group wants. And so I think that I can't answer that right now, but I think there could be or there might not be. It's hard to tell. Denise?
Thank you. I just wanted to say a couple of things about, you know, how the CHIP Substance Abuse Mental Health Work Group, which was formed in 2016 by Karen Obermeyer, John Nowak, Dunya Fow, or Foe, if I'm saying that name incorrectly, and me and the people who were at Discovery Behavioral Health at the time. I think that Kathleen Clare was our commissioner on that group, you know, kind of put a work plan together for this CHIP group. And then this CHIP group kind of stagnated. And then when Lori came aboard as a co-executive director of CHIP, she was able to start the Behavioral Health Consortium. And so that CHIP group became the Behavioral Health Consortium. And it was recognized that on the work plan, there were many, many things that were happening in the county through the substance abuse prevention coalitions, the community prevention and health initiative coalitions. And so there were many, many meetings. One I remember that was out at Fort Gamble, or no, I'm conflating something, excuse me. But there were many, many meetings where Lori invited many players. It seems like there was one at the fire station out in Chimacum, and there was one that was at the hospital, but many players to come up with this plan, and then went after you know, an exploratory grant, and then an implementation grant. And through this implementation grant, we've had like some enormous successes. One of them is this Behavioral Health Consortium. And some of them are the work that's in South County happening now. And as a result of that, we now have a harm reduction coordinator within Jefferson County Public Health, which is the fiscal agent for the Behavioral Health Consortium and the grant holder for the Behavioral Health Consortium. And so that work is going to continue because now we've got this harm reduction coordinator and the whole team. So that this is a huge win for the BHC, right? And then we have a We have 3 coalitions all in all the school districts that are operating much more strongly than they had prior to this. And we figured out this way to get all this funding out into the community for youth prevention to provide protective factors. And that tobacco cannabis money will be there again for us to use next year. And the coalition money will be there again for us to use next year. So those kinds of things are going to continue. And this is all momentum that's come from this CHIP group that wasn't doing anything, that became the BHC, that is now this enormous working entity that is doing a great job here in Jefferson County. And then the Recovery Cafe, the money that has gone to support Recovery Cafe from this HRSA grant, and the initial beginning of Recovery Cafe, which I was a part of, that has just gotten stronger and stronger and stronger. That is an incredible win for all of us in Jefferson County, as well as what Kelly has done with Owl 360. That is an incredible win. So we've got a lot of great things that are rolling that aren't going to disappear if we don't have another HRSA grant, because we didn't get the one that we applied for last time. And we have, the whole new CHIP coordinator role, the CHIP manager role, that is going to carry forth what the CHIP groups did in 2016, the 3 aid bans from 2018-19, and then the CHAW that will happen now, that will determine what the community is interested in carrying forth. But none of these things are just going to get forgotten about. So I just wanted to say that out loud, and I'm sorry I wasn't that articulate and it took me a long time to say it.
Thank you, Denise. Sheriff Knoll?
Yeah, I just want to say that I'm an advocate for continuing the Behavioral Health Consortium. And I don't know how many people on here were participating in county government or county works when there wasn't such a thing. And we did all work in our own little silos, and it was hard to get together and do things. Sometimes I hate to admit my ignorance. Sometimes I don't know exactly what we do with the Behavioral Health Consortium. But one thing I do know is we all get together and share ideas and whatnot. And like Denise was saying, there's been a lot of things that have come out of this, and we all participate in other groups and meetings that we see each other in, and it just all seems to tie together. And some good things have happened. And my thought, I don't know exactly how the funding works, but that when this grant is over, Lori or whoever, all of us we get another grant and see what we can do with that. I don't know if that's realistic or not, but I find this is something that is really beneficial to the community, and being able to, serve each other and do the right thing. And we all come in here with our various expertises and experience. And I find it really beneficial.
Thank you, Sheriff Knoll. Brian?
I'll be quick. I'll also advocate for continuing this group. And almost Chief Black's question in and of itself to me is justification for keeping this group of folks together. The fact that there is a venue to ask those questions when there's everybody here, I find valuable. People are going to change in these positions over time. Our programs are going to change over time, and in response to changing needs in our community. And that's just the reality. So there are other, groups that convene with lots of us in some of those meetings. And I think the structure of this is such that, well, we've gone through some challenging conversations around how best do we support the behavioral health of our community. And then the sharing of ideas that Sheriff Knoll talked about as well on how do these different things fit together. So that's my take. I'd like to see it keep going.
Thank you, Brian. Jim?
So I think Denise eloquently stated the history of how and why CHIP grew, and then and how this grew, the BHC, and the importance of it, and all the things that have come out of it, which really supports the continuation of this group. It supports the continuation of these minds of people coming together here to really assess the needs of this community's behavioral health needs across the board and the different people working together, and helps stop and create less fragmentation of these services. You know, I've been over 3 different states doing behavioral health for 30 years, and I watch communities fight over money. Where I see a difference here, I'm proud to say next week I'll be here 3 years, and I've watched the growth in 3 years of this community, and watch us come together and really parcel that money together in a common good. And I just really think the importance here of CHIP is of the BHC as the one group, and I've stated this publicly before, this is the only meeting that I come to, and I feel like there's something positive that comes out of it, substantive that comes out of it. There's a lot of meetings that give information and talk about things, but this is actually the talk develops into outcomes that really produce something. So yeah, I'm very supportive of continuing this BHC in some format under somebody's roof. And I think that's the next task that we have to figure out is, how do we sustainability? So.
Thank you, Jim. And Apple? Yeah.
Sorry, thank you.
Very good.
I've been having internet difficulty, so I was on mute. I just wanted to wrap up some of these sentiments and many agreements here, and appreciate your expressing the sentiments. And thank you, Denise, for the history. It always helps to anchor the thought process. The addition that I would love to make is what I've seen this group do, which is extraordinary. And there are many things, of course, and how that lives in the future is what we're talking about now. I don't know what the future will be, but an angle on that I think is relevant is the data collection portion in this conversation, in this group over the many years. I've really witnessed some evolution in folks thinking about the work that they do. And I want to make a nod to Lori and to Lisa Grindle, who I don't see as much anymore, who used to attend these meetings and a lot of the presentations, as well as the data subgroup, I believe, that either still meets or definitely did meet for a long time. I think that there's been a real growing sense of what it means not only to be obligated to provide data, to measure and assess the programming that we're doing, but just how we give to that data collection collectively. And what I noticed is a real effort on everyone's part who is sitting at this table to really learn deeply how gleaning that data and working to finesse the questions that you ask in order to obtain the data provides the story and also gives us a lot of content to grapple over together. So all the things that people have said, I do agree with, and there's more to say, but that was an angle that I wanted to be sure was expressed.
Thank you, Apple. Patrick, and then I want to move quickly to make sure that at least I highlight this funding request from Recovery Cafe. Go ahead, Patrick.
Well, very quickly with what Jim and Denise and April have all said, it's also good to get together just because I think we energize each other. We encourage and support one another, and that's very important. And building a little bit on what April said, it's really good for us to look at what we're doing in terms of evidence-based stuff to deal with facts and information based upon what we're doing and what needs to be done. And I think that's extraordinarily important.
Thank you, Patrick. Okay, thank you all for sharing as completely and honestly as you have. We'll take all this away and think about it and come back at our next meeting with whatever that thoughtful approach is to the next steps. I will share quickly the funding request from the Recovery Cafe that I'd like to put out there. As I mentioned, and Brian, maybe you want to talk about it. Maybe I shouldn't be the one overviewing it.
Sure, I'm happy to. I'll admit I do feel a little sheepish about it. Lori came to visit for lunch last week, and so we were talking shop a little bit about how the program's running and what our needs are going forward. And I'll acknowledge, of course, that we are the largest recipient of funds from this program. So I'll just preface by saying, if there's question about the value that Recovery Cafe provides in the community, I get that. And I would also love to address that at another time, I guess. But I feel very confident in the work that we're doing in addressing the goals of this whole group, and in making recovery stronger in our community. So anyhow, when Lori and I were talking about it, she asked, what would you need if you really have what you wanted? So didn't know this was going to be coming up. It's totally fine, Lori. Thank you so much for advocating for us. But yeah, when I was talking earlier about increasing our hours, part of that was this helps to support us doing that. So we put out 40, 50 meals a day, 4 times a week. And that is what we found to be the most effective tool of engaging people who may not otherwise come in the door in the first place. So they come in looking for some food, and then they find, you know what, maybe these people are all right. And then they're able to access, as a resource hub, all these other services and programs that our partners come in to provide, like OLICAP and Believe in Recovery and the Real Team and all these folks. So that's the idea, and where I think we can provide a lot of value. So I know we're short on time, so maybe I'll just leave it at that for now.
Okay, I will send out a message to the voting members just to see if there are any other questions they have, and then we'll take a vote at our next meeting, I think. In the meantime, I wanted to quickly share the results of our poll and to thank you all for being here. Any other last thoughts before we go? I know we're at 4:02. All right then. Go forth, have a wonderful afternoon. Thank you for being here. We'll see you next month.
Thank you, everyone.
Thank you.
Thank you.